Good morning. I'm very glad to be here today, and I want to start by thanking Ronnie Zehavi for the initiative, for organizing this workshop, which I believe is very important to everybody sitting here in the room. And may I say that we are also looking forward to collaborating with the Ben Gurion people and with the Cyberspark people. The topic today is smart hospitals. I'll be talking about the vision. I'll share with you some of our systems in Soraka Medical Center, and there is a happy end. So let's start. First of all, what's the vision? What's the goal of smart hospital? Actually, it's all about our main issues. It's all about our core business. So the idea is to improve patient care, patient satisfaction and safety, to optimize workflow and reduce operating costs. So that's the vision. Now there's a huge challenge because we are not used to it. What you can see that actually today, if you look at much of the technologies that we use, they are currently found in highly disparate systems, and most of the applications of these systems leads to significant amount of manual coordination, and actually it reduces workflow efficiency. So we must look forward to implementing some new ideas, and this is what I'm going to talk about. So what are the objectives of smart hospital vision? Number one, it has to be patient-centered to facilitate and improve patient care, satisfaction, safety, and experience. Number two, it has to be staff-centered, be able to facilitate and improve staff satisfaction, productivity, and efficiency. We all understand that without improvement of the activities of our staff, nothing can be achieved. It has to be hospital-centered. We are talking about smart hospitals here to facilitate and improve resource utilization, efficiency, and our financial performance. Number four, system-centered. So smart hospital has to embrace and integrate with the local community. We are not a standalone organization. And then the innovation part, it has to be innovation-centered. It has to be we have to be able to encourage, facilitate, and lead the development of innovations in healthcare delivery. So that's the concept, the general concept. Now let's talk about some of our systems and progresses that have been done already at Soraka. Well, I'll be talking about our intra-organizational operational systems. I'll be talking about some digital environment that really leads to great benefit to the patient. I'll say a few words about our new application and our website. And then you'll see how we turn a lot of information to information or to data that helps us on the daily basis of management of various aspects of the hospital. The way we do it is by advancing what we call pop-up information, but I'll be explaining that later. So this is a list of some of our intra-organizational or Soraka operational systems. I'll be talking about a few of them, not all of them. And let's start with the most important system I think that we have that contributes a lot to quality of care, and maybe it's the one that contributes more than any other system that I know, which is the electronic medical record. Now in Clalit hospitals, and of course in Soraka, we adopted or implemented this type of electronic medical records to all the inpatient departments, to most of our outpatient services, and in the emergency room. And there's a room in these records for whatever doctors and nurses want to write down, as well as other paramedical professions also. So all of the hospital's systems today interface with this medical record, the Chameleon, and they enable actually display of the patient's current and past medical history. And of course, this is done simultaneously in various sites in the hospital. What are the advantages of this system? It's not just, of course, it's not just a typing machine. It has a lot of advantages which are very important for us when we speak about promotion of quality of care. Number one, there is a uniform language for everybody. It promotes continuity of care between hospital units, the connection to the community, very important to us, and improved ability to transfer order and messages between various organizations within the scope of the healthcare system, not only Clalit, but also with other parts of the system. Improved quality of care due to the fact that we implement various medical protocols and algorithms within the electronic medical records. Connection to medical equipment, I'll be talking about it shortly. Better options for research, for monitoring, and information security and protecting patient privacy. A very important part that has to be implemented, we just started, is the connection of medical equipment to the electronic medical record. It makes it possible to enter the medical information more precisely without any manual action, and that, of course, ensures the accuracy and the safety of the information and verification of the various parameters. Another type of electronic medical record is called Metavision. This is a system of medical records that is active in specific departments, basically operating rooms and various intensive care units in the hospital. This system is already connected to the medical equipment, and it can provide us with medical measures on the patients in the various departments. And the clinical data transfer process is done automatically from the medical equipment, and we hope that this process can be implemented in the Chameleon electronic medical record also. PACS and RIS. PACS actually is a system for picture archiving and communication for medical images, for what we call image systems all over, actually not only Soraka, but for us, we are part of the greater PACS system for the entire Clalit healthcare organization. It means that wherever a Clalit doctor is located, be it in a hospital or in a community clinic, they can see the picture of any image that a person has performed wherever that has been done in the Clalit, of course, and in many of the other institutions, including governmental hospitals. Everything is connected to the same system. So when a doctor sees a patient, he can open the electronic medical record, he can open the PACS system, and he has actually all the information he needs for making the right diagnosis. What are the advantages of this system? It allows high quality of interpreting, high access to medical history, reduction in the number of imaging tests and in the amount of radiation per patient. It's part of the system. It helps us, and we measure today how we can lower or decrease the amount of radiation per patient. It saves the data. Digital comparison tools. We can compare current picture with one that has already been done previously. Speed and immediate availability of consults and opinions, databases for research, and of course, it's all about paperless work. Another system is the operating room system. If you ever visited my room in the hospital, you would see this screen in which I can see actually what's happening in every operating theater at Soraka at any time, and you can just ask questions or pick up the phone and talk to people that are responsible for these operations. So it helps us to optimize the utilization of time of our surgery scheduling system, control of collection through connection between procedure and prices, follow up all the time about what's happening there, follow up monitor for families. By the way, we provide them with information about the status of a patient in the operating room, online collections of times during surgery, and then we have on this system the surgery reports themselves. Additional information about digital environment. You can see several projects that have been developed at Soraka and other projects that are still in process in the hospital. Let's start by a very important service project, the QFlow, which is the digital service stations that are scattered all over the hospital, mainly in outpatient clinics, but also in the emergency room. And actually its objective is to add digital service stations for management of appointments at the hospital, control of waiting times, and provision of quick and efficient services. Actually, the main issue here is to reduce uncertainty for patients, you know, that are sitting by the room of the doctor, waiting for their chance to get in, and being afraid about the, you know, the people that are there waiting in line, and everybody is very conscious about the time that they have to go in. So this was QFlow. Another very, very interesting project that I'm very proud of, it has been done in collaboration with the National Insurance Institute. We call it First Class, and the idea actually is to increase accessibility of patients to their rights. What we do here, that we, if somebody gets a new diagnosis about a disease that actually derives certain rights, they start the process in the hospital by talking with social workers that proactively identify hospitalized patients. They just go into our IT system and find the diagnosis that actually derives those rights. And the system starts to work until we get to what you see there at the bottom of this slide. So we have computerized transmission of data about the patient to the National Insurance Institute. And then the National Insurance Institute opens a claim, sends to the patient, sends a question to the physician to determine eligibility. And there's no need to summon the patient to a committee when they get out of the hospital, and later the patients get their allowance. By the way, we were the first to adopt this system, and now the National Insurance Institute tries to implement it all over Israel. So this is the slide showing you how it works, and this is a claim for getting allowance to patients hospitalized at Soraka. Text messaging system for ER patients. By the way, text messaging has become very, very popular. And it seems that people like to send them and even like more to get them. So the idea here is to send a message through the smartphone to emergency room patients. They are sent now 5 times for each stay in emergency room. When admitted, when assigned to a physician, when assigned to a nurse, notification that laboratory has received blood tests, and when the physician starts, if you are going home or you are being hospitalized. So this is how it goes. Dear patient, welcome to the Department of Urgent Care. The staff is doing everything we can to provide you with professional treatment and outstanding dedicated service. This is being sent to each patient that is being admitted to our emergency room about 10 minutes after entry in the electronic medical record. Then they get the next message. The nurse responsible for your care is Shula Israel, and this is being sent 2 minutes after assignment in the Chameleon about the first nurse. We assign the patient with the first nurse. Here is her name, and the patient gets the name. Then you have been assigned a physician. This text is being sent 2 minutes after assignment in the electronic medical record of the first physician that has been assigned to this patient. And now the last one is whether patient is being hospitalized or is sent home. And he gets this message: the doctor decided to admit you to the internal medicine department. You will be transferred shortly. The patient gets this a few minutes after the actual discharge happens in the electronic medical record. Or we say, you have been discharged from the emergency room at Soraka. The emergency room staff wishes you the best of health and thank you for choosing Soraka. We have some ideas about future advancement, and you can see our patients will be dealing with the messages during the entire stay in the emergency room. They will have to read messages during the entire period that they are waiting in the emergency room. Next idea. Go ahead.
Is it only for the patient or for the patient relatives as well?
Well, it's for the patients now, but we're thinking about relatives too. By the way, in the emergency room, in the operating theaters, we have a system that talks with the relatives, saying the patient is operated on, then they go out of the operating room, then family can go and talk to a doctor. Everything is done by texting.
It can be dualic. Both of them can...
Sure, no problem. Next one is using QR codes in the campus of Soraka, which is huge and which holds some 30 buildings. So we have new maps all over the hospital, in certain places, in the entrance to the hospital and other crossroads within the hospital. We got various colors for various parts of the hospital, and everything to allow patients to get to wherever they need to their target quicker and easier, because it's quite complicated to get to a place that you want to go, and taking into account that we change places from time to time because of all kinds of infrastructure and development. So the idea is to post directions and signage at the hospital according to division into areas and different colors. And we are talking about the use of cellular phones by scanning a QR code that appears on the maps, on the colorful maps all over the campus. And you go with your QR and you get directions how to get to whatever service you need in your smartphone. So this is how it's being done. A few words about our about Soraka app. To the best of my knowledge, there are no other hospitals apps up to now in Israel. It's a unique one that actually tries to, first of all, to provide best data and information about hospital services, doctors, and so on, and tries to be even to be interconnected to various organizations and people. And you can see what we include or what we have in this application. We have navigation, we have phone book, news and updates, video channel, centers of excellence at Soraka, a link to our website, send feedback, and information at a click. It also includes a very important area that we call the employee areas. So it's not only for patients or customers. It's also for employees. It has the phone book, all kinds of information from human resources, and so on. And this is how it looks like. You are all invited to get our application as we speak. A new website being developed together with the Clalit headquarters. So it's a new one. It serves as a broad platform, can be used to obtain information about the hospital, departments, services, experts, and breakthrough treatments that we have. And this is a list of types of information that you can get on our website. I'm not going to list all of them, but you can see the information that is found nowadays in the website. Pop-up information. So this is the advancement that we have that helps us to advance and improve our operational system. It pushes real-time information. It is designed to push information and data in real time to various people or to various managers that are in charge of various aspects of the hospital. It can be operational, it can be quality, it can be economical. I'll show you two examples in order that this will be much clearer. So we use the traffic light colors, and when a line where a patient is written is colored in green, that is the target has been met, and when it is red, the target has not been met. So I want to show you two information in order to make it easier to understand. There is one of the most famous quality parameters in the entire hospital, in all hospitals in Israel, is that we have to perform surgery for hip fracture within 48 hours. This is not so simple. A lot of people are involved in it, a lot of departments, and not only doctors and nurses. So how do we cope with this very complicated mission? One of the ideas is to have this information system in which each patient is written there, each patient has a line, and the system automatically counts how much time has passed since the admission of this patient, since the diagnosis actually, that he has hip fracture, and it counts the time. When it reaches, when it has passed 48 hours, it's a failure. It will be colored red, too late. What's important for us, it's the color yellow, means that like 36 to 40 hours have passed. Now we have to be very, very quickly, because the quality measure itself has to do with life-saving. We know that if we wait too much time, the outcome of a patient is worse. So it's very important. And what you can see down here, the graph shows you that we were getting only 56% as a mark of our performance, but within 2 months, that is to say on June 2013, we reached a mark of 100% and stayed there ever since, using this system that actually alerts everybody in the chain that have a role in performing this parameter. Pardon?
2 minutes.
2 minutes, okay. This is another example. It has to do with length of stay in the emergency room. Same principle works here. And this is a diagram showing you how we take the very information from our systems and turn them into databases, turn them into data, and at the end develop these pop-up information that we get all the time, which helps us to create some change in our behavior in order to be able to cope or to deal with the various objectives that we have. Information security, of course, actually this is the main issue of today. Very important. The system is very vulnerable. We know all about it, but I'm not going to talk about it because there are people that know about the system and what tools we use. Here's the list of the tools we use in order to secure the medical information that we have. So to conclude, the key features of Smart Hospital are, first of all, interoperability, then mobility, unified communication, digital, interconnected, based on automated systems. So, last two slides. In conclusion, smart hospitals provide an opportunity to improve the quality and safety of patient care, reduce inefficiency and waste, support world-class clinical research, and enable better management and administration of the hospital environment itself. And at the end, I want to say that we in Soraka, we have a vision. We understand the challenge. We've taken, as I've shown you, many steps to realize this goal. And I really believe that we can say that we are starting at least to be a smart hospital. Thank you.